Today we are going to discuss cephalosporins. Basically, cephalosporins are from class of beta-lactam antibiotics and they have a nucleus called 7-aminocephalosporinic acid nucleus. They are bactericidal in action because they inhibit the cell wall synthesis by binding to penicillin binding protein, also called as PBPs. They are classified into 5 generations. The following pathway discuss regarding the mechanism of action of cephalosporins. Firstly, the cephalosporins molecule enter the bactericidal periplasm by passing through porin channels in the outer membrane, then they bind selectively to penicillin binding protein, forming a covalent bond. This bond inactivates the PBP, preventing it from catalyzing the transpeptidation of peptidoglycan strands. Without cross-linking, the peptidoglycan layer remain weak. The compromised cell wall cannot withstand the bacteria's internal osmotic pressure. Thus, the cell wall rupture, causing cellular content to leak out, resulting in bacterial death. The most common side effect of cephalosporins include nausea, vomiting, diarrhea, stomach ache, headache, skin rash or itching, mild fever, oral or vaginal fungal infection. Serious side effect of cephalosporins include severe allergic reaction, anaphylaxis, severe diarrhea due to Clostridioides difficile infection, kidney damage, liver dysfunction or jaundice, blood disorders, seizure and severe skin reaction like Stevens-Jones syndrome. Important point is that the patient allergic to penicillin may also show allergic to cephalosporins in some cases. Cephalosporins are classified into 5 generations. The first generation include oral drugs such as cephalexin, cefadroxil and cephridine, and parenteral drugs include cefvazoline. They are active against gram-positive Cocci streptococci and staphylococci. They are not active against penicillin-resistant strains. Indications include skin and tissue infection, strep throat and surgical prophylaxis. Second-generation oral drugs include cefaclor, cefuroxime acetyl, loracabef and ciprozol. Parenteral drugs include cefuroxime, sfotatin, cefoxitin, kefametazole. They are active against gram-positive bacilli such as E. coli, Klebsiella, Proteus, human influenza, M. catarrhalis, bacteroides. They are active against bacteroides. Such drugs include cefoxitin, sfotatin, kefametazole. Indication includes sinus infection, community-acquired pneumonia and pelvic inflammatory disease. Third-generation oral drugs include cefixime, cevapodoxime, ceftabutin, kevadatorin, kevadonir, and parenteral include sfotaxime, ceftizomine, ceftriaxone, ceftazidime, cefoprazone, moxilactam. They are active against gram-positive and negative Cocci and also active against gram-negative bacilli. They are also active against anaerobes. Indication includes severe or complicated infections, meningitis, gonorrhea and hospital-acquired infections. Fourth-generation parenteral drugs include cefepime and kevapirome, active against same as third-generation and show more resistance to beta-lactamases. Indication includes febrile neutropenia, severe complicated UTIs, hospital-acquired pneumonia. Fifth-generation parenteral are ceftaroline and ceftobiprole. They are active against methicillin-resistant Staphylococcus aureus and have less activity against gram-negative organisms. Indication includes complex skin infection and community-acquired pneumonia.